Hello, in this video I will be discussing Parkinson's disease. What is Parkinson's disease? A neurodegenerative disorder of the central nervous system that affects movement, which often includes tremors. There is medication that can help control these symptoms, but Parkinson's disease, there is no known cure for Parkinson's disease. Epidemiology. Parkinson's disease affects 1 to 2 per 1,000 of the population at a time. This affects the population above 60 years old. Estimated to be 4.5 to 21 per cases per 100,000 population per year. The USA with 329.3 people per 100,000 populations have Parkinson's disease. Risk factors for Parkinson's disease. Age. People are commonly seen with Parkinson's disease above the age of 50. Heredity. Having a close relative with Parkinson's disease is also a risk factor. Another risk factor is if your sex is men, because men are most likely to develop Parkinson's disease. And lastly, there are certain toxins that can cause Parkinson's disease. Now we're going to look at the pathology of Parkinson's disease. Parkinson's disease is primarily associated with gradual loss of cells in the substantia nigra of the brain. This area is responsible for the production of dopamine. Now, dopamine is a chemical messenger that transmits signals between two regions of the brain to coordinate activity. If there is a problem with dopamine in the striatum, the nerve cells in this region lose control. This leaves the individual unable to direct or control movement. While looking at the pathology of Parkinson's disease, there are also stages of Parkinson's disease. Stage 1 is mild symptoms of Parkinson's disease and often seen on one side of the body. The symptoms are tremor of one hand, rigidity, clumsy leg, one side of the face may be affected, impacting the expression. Level 2, the symptoms are still mild. It's both sides this time. The symptoms is loss of facial expression on both sides, decreased blinking, speech abnormalities, rigidity of the muscles in the trunk. Level 3 is moderate symptoms of Parkinson's disease are categorized by the loss of balance and slowness of movement. The symptoms would be balance is compromised, inability to make the rapid, automatic, and involuntary adjustments, and other symptoms of Parkinson's disease are present. Level 4 is more severe, and they are severely disabled. The symptoms would be patients may be able to walk and stand unassisted, but they are noticeably incapable to walk by themselves. Patient is unable to live an independent life and needs assistance their whole life. Level 5 is the most severe. These symptoms are categorized by inability to rise. Symptoms would be patient falling when standing or turning, may freeze or stumble when walking, and they also have hallucinations. These are the levels of Parkinson's disease. As seen in this picture, compared to the healthy brain, Parkinson's brains, there is more activity of dopamine in the brain, as you can see. The signs and symptoms of Parkinson's disease involve tremors, trouble moving or walking, loss of smell, trouble sleeping, small handwriting, soft or low voice, constipation, masked face, stooped or hunched over, dizziness, or fainting. These signs can also show hypoglycemia as well, but you can rule that out with blood sugar. Diagnosing Parkinson's disease. There is no real way of diagnosing Parkinson's disease. There's no test, there's nothing like that. They diagnose you by looking at your medical history. They also do a physical exam on you. They also do a neurological exam. They also look at your signs and symptoms, and they may do an MRI, a CT, and a PET scan. The PET scan is more likely because they can see if there is high levels of dopamine or low levels of dopamine in your brain. Prognosis of Parkinson's disease, partly related to the age of onset. If symptoms start in the middle of your life, it is more likely to shorten your lifespan. Parkinson's disease itself is not a fatal disease, and the average life expectancy is likely that of a person without the disease. Secondary complications such as pneumonia, fall-related injuries, and choking are most likely to increase your risk of death, not the disease itself. EMS complications of Parkinson's disease. When treating a Parkinson's disease patient, it is important to realize that they might have this disease. Patients might have trouble talking, so take the conversation a little bit slower to better understand the patient. Also, patients might move slower with Parkinson's disease, so taking it slower or helping them would be a great help to the patient. Parkinson's disease dementia is a significant issue for people with Parkinson's disease. So try to make a relationship with the patient to make them feel safer and thus making it easier to talk to patients. Some resources that help with Parkinson's disease. The Parkinson's Disease Foundation helps with money-related issues like paying for a CT scan or paying for a PET, the device that shows you the dopamine level. They can also help with having regular checkups, making sure that you're okay, making sure that the disease is not progressing, and also getting treatment. Another resource is the Michael J. Fox Foundation for Parkinson's Research. This is a resource that helps with awareness of this disease. So they can help you with finding other resources that are better suited for you.